First, we are going to remind ourselves what it means to be an agonist. Okay, I had a couple questions about this last class. I'm going to give you a couple different examples. An agonist is a muscle or muscle group that's doing a job of rotational influence above rest. Okay, they get called to do a job. Y'all know what the Arnold the pump. You know, when you work out hard, you feel a pump in certain muscle groups. Biomechanically, what's happening there is, let's say when you're doing curls, your body is sending extra pressure, like squeezing a tube of toothpaste, a mini Valsalva maneuver of the agonist muscles doing the job. In this case, your bicep, brachialis, brachioradius, all the elbow flexion. All that pressure is pushing fluid into the interstitium of the cells from the capillaries. Like if you take pressure and push it, it's going to push fluid out. And so all that fluid gets pushed out into the interstitium. And when you relax, you have more water in the water balloon than when you stop because of that pressure. You don't do curls to fatigue and then feel the pump in your tricep. You feel it in the muscles that you were using to do that exercise. Does that make sense? So the confusion was when you're using an agonist or when you're working out, wouldn't you have lengthening of your extensors as you flex? Yeah. That doesn't mean they're an agonist. That doesn't mean they're doing anything. That doesn't mean they're doing a job. If agonist and antagonist was just about motion, then I could get an amazing workout just laying there and having some machine move me around. Or imagine passive range of motion, or in other words, it's not just about lengthening or shortening. It's about lengthening and shortening while those muscles are being recruited or activated above rest to do a job of movement influence. There's a reason we say that this exercise works the bicep. If we had eccentric of the tricep coming up because it's lengthening and then shortening of the tricep going down because it's shortened, then we would get a bi and a tri workout by just doing the bis. Does that make any kind of sense? So what we do is we say the agonists are the ones doing the job. They're shortening and lengthening while they're working above rest. And the antagonists are the ones that aren't doing the job right now. They may be shortening or lengthening because they have to, because that's how structures that pull work. But they're not being recruited above rest to do a job. They're taking a break. When it's time to work them, I'm going to use an external force that's trying to flex me, and I'm going to work tricep and coneus, and the bicep get to take a look. So agonist has nothing to do with only shortening and lengthening. It's shortening, lengthening, or staying the same length while being recruited above rest. Does that make a little sense? So what I can't do is I can't say I'm doing lateral raises. I can't say that my adductor muscles are working eccentrically when I do this because they're not doing a job. They're not doing anything. That would mean any one exercise you do, you get to work all the muscles. That's not how this works. That's not how this works. There's a reason you got to do bicep stuff and then go do tricep stuff. I hope that helps a little bit. All right, let's get to this bear. We'll start and we'll just keep plugging away. All right. Muscles that function together. So first thing, guys, is I give you some holistic, we break everything down by individual muscles, but I love to just show you how kind of all these things blend in. You know, I'm not even holding you accountable. But quadratus lumborum, you have psoas major and minor. This sartorius kind of overlaps the origin of the rectus. That rectus lies more superficial to the vastus intermedius. There's some things you can't see because there's pulley muscles on top of it. So what we have to do is we have to say, man, there's a lot of stuff happening here. Let's click and remove all the muscles except the one we want to look at so that we could just see how it's contributing to it, okay? But obviously they all kind of are in the same classroom, but it's hard to see all of them because some lie on top, some get distracted when there's your pectineus, your gracilis, some of your adductors you can't even see because they're more deep to some of the ones superficial. I have another picture of just kind of how if you look at the whole city, there's a lot of stuff going on. Okay, so we're going to analyze them joint by joint. I love this picture because we take the gluteus maximus and we take it out and we say, whoa, look at all these muscles that are living inside that are being covered up by the gluteus maximus, as my kids used to call it. Right? So as mentioned last class, we have 6 kind of deep hip rotators. All of them except for the piriformis are going to have horizontal pull across, spinning pull, spinners as I call them. They're lateral rotators. We're going to hit them up individually. Apple, banana, strawberry, sledgehammer. Look at that piriformis, how it's like in a quadrant that the others aren't, right? So those others are very horizontal. And then we get to that piriformis, and that piriformis is running at a much more obvious angle. So it's going to have different functions that the others don't, that just have that X pull, that horizontal pull, okay? Once again, kind of covering it up, the obturator externus is going to have the exact mirror function on the left side as it does the right side. They're mirrors of each other. Doors open, doors close, mirrors of each other. All right, let's look at the obturator internus. You guys remember from anatomy, like the obturator foramen, right? That kind of hole in that's formed at the hip that things can go to. So that's kind of how this kind of gets its name on the obturator. And it's crossing the hip. This is let's use clues. Is this an anterior view or a backside view, a posterior view? Good, good. Oh, we can see this coccyx. We don't see the pubic symphysis, right? We can see those trochanters really good. This is a posterior view. So this muscle is crossing the hip posteriorly. So we can almost visualize how this muscle, when it pulls, it's going to try to pull the hips laterally or externally. It's pulling in a direction of external or lateral rotation. Makes sense? Sometimes with hip stretches, remember in 310 we talked about the illusion caused by flexing the knee with external or internal rotation. Do you remember that illusion? So if someone has a tight obturator internus or externus or a tight lateral rotator, remember how the illusion of the cervical, where you're shortening the sternocleido, but you're stretching the right side erector, but that right side erector starts to come towards the front, so you feel that stretch, you think it's the front. So sometimes we got to remember this is important for function. If I'm trying to stretch an external rotator, I don't need to externally rotate, even though I might feel a stretch in my posterior capsule or in other areas. I need to internally rotate my hip in order to stretch an external rotation pull. So if you're doing circles, if you're doing function, no problem. Look, obturator internus, externus, those are all just hip external rotators. If you're doing circles, these 5 are in a bowl, and that bowl is on the AP and bilateral axis. They're neither in front or behind, right side. They sit literally in the middle of class, and all they're trying to do is pull in a direction of lateral or external rotation. Make sense? So gemellus obturator internus, obturator externus pulls the same kind of way. Look how it crosses the hip laterally. It's trying to bring that posterior femur towards more of the pubis, pulling laterally, pulling externally. Gemellus superior and inferior, same direction, pull horizontal, pulling posteriorly, laterally, externally, and the inferior gemellus, or as we call it, gemellus inferior. So notice what they have in common. Same type of pull, all of them. Yeah, they have different origins and there is different insertions, but when you think of it like this, when you lay them all, it's like the hips rotator cuff. So like you look at a rotator cuff and it looks like a capsule of muscle surrounding the humeral head. They're separate. It's like I call it covering your bases. Like you have, someone's got to do first base, you got to cover second base, and then you got to shortstop and third base. Like you're covering all of your bases there. It's posteriorly making sure we cover all of those bases as well with lateral rotation. So in other words, when you look at them separately, it doesn't look like much, but that's why I gave you kind of this whole encompassing picture just to show you when they're all together, you're literally covering kind of that femoral head, kind of like the hips rotator cuff. Quadratus femoris is a square-shaped quad muscle of the femur. Don't confuse quadratus femoris with quads. Don't confuse quadratus femoris with rectus femoris. We're going to have another muscle in our upper extremity called pronator quadratus. It's just a word we'll give for square-shaped kind of rectangular muscles, okay? But in terms of its function, again, just look at it. Crosses posterior. Look at that horizontal pull. It's literally just trying to do this. It's pulling in a direction of external or lateral rotation. Apple, banana, strawberry, cherry, sledgehammer. Piriformis. Okay. Now, again, this muscle now has a much, I'd say much different, but it has much more of an angle that those other horizontal pullers didn't have, right? So if we look at it, now we're crossing the hip joint, not just transversely, but now we're crossing the hip joint laterally, crossing on the outside of the hip. So when it pulls, it's going to pull in a direction of hip abduction. It's an abduction puller as well as an external rotation puller. This view, I think, is a good view for the abduction pull. But we just established that all of those other muscles that ran very similarly in the back that had an X component to its pull was a lateral rotator. That muscle has an X component pull. It just also has a Y component to its pull, and the Y component is the abduction pull. That makes sense? Because it has a secondary function of being an abductor, and because we use abductors every time we take a step, like when we have gait, if I'm walking and I weight bear on any leg, right or left, my abductors of that leg are going to turn on, because if they don't, I'm going to fall off. So we're constantly recruiting abductors when we take steps, when we walk, okay? So this muscle gets recruited a lot more than he or her cousins. In addition, the geography of this sciatic nerve relative to the piriformis is a big deal. I think I mentioned it last class. Some people, not everybody's made the same, similar, mostly, but our plumbing can be a little different. And some people's sciatic nerve runs deep to the piriformis, some run superficial to the piriformis. Some people's sciatic nerve literally runs through the piriformis. And so as much as we sit, as much as we're prone to tightness because of posture, I'm kind of a hypocrite right now. You have posture sitting in class. You have posture when you're driving. You have posture when you're studying. It's just natural to kind of have these kind of set sling postures. So some of the things we might do in ergonomics to help is, you set a timer every 30 minutes, it goes off, you get up and you move around a little bit, just to try to generate a little blood flow, get that arm out of that sling. So that is the function of the piriformis. And now, should I or should I not? Yes, why not? All of our functions are from anatomical position. Okay? All of our functions are from anatomical position. There are, I think I mentioned this, there are some muscles that can switch their function depending on the position you're in. I told you about the rectus, even though I'm not going to hold you accountable for it because I don't want to confuse you. The rectus, if I twist to the right, is trying to pull me back to the left. And if I twist to the left, it's trying to pull me back to the right. One of the reasons that the piriformis stretch works, because if you think about it, you're like, well, wait, if the piriformis is a lateral or external rotator, in this kind of position, aren't I laterally or externally rotating? The answer is yes, but you're not an anatomical. So hear me out. The piriformis is an abductor external rotator. So it kind of runs like this at this angle, okay? In anatomical position, it makes sense how it would pull laterally and how it would pull here. When I flex my hip roughly about comme ça, I think that's scientific, Cajun scientific. Notice how now that hip is straight in line. It's not trying to spin me at all anymore. All it's trying to do is pull this way. Down here, it's trying to external. Here, it's like a rectus abdominis. It's just pulling straight. So what would happen if I keep flexing? Well, now that muscle is actually an internal rotation. We switch its function based on our position. So that's why for that piriformis stretch, you got to flex first to reposition that muscle as an internal rotator. Then you can externally rotate and stretch it transversely. That's only some FYI stuff. On the test, all of our muscle functions are going to be based off of anatomical. Okay. So let's look at our piriformis. There's your list of functions. Here's your circle of functions. PF, piriformis. Abductor, because it crosses laterally, and external rotator, because it's trying to spin the merry-go-round externally or laterally. Make sense? Or if you learn about your list, you're like piriformis, hip external rotator, hip abductor. It's saying the same thing. Hip external rotator, hip abductor. We knew that about the piriformis. It switches function when you do this flex. All right, you got your money's worth. All right, let's talk about the gluteus. And guys, at any time, I just forget because it's a new teaching tool, but at any time, if you want me to go to the PowerPoints, or remember, you have access to the PowerPoints and you can click any particular muscle and see that direction pull. All right. What do we know? We know that our pectoralis major has like an upper pec, and some people call it a lower pec. Whoa. We have sternal fibers, we have clavicular fibers. These are muscles we call fan-shaped muscles, okay, in layman's terms. Fibers, you know how you've heard or learned like all or none principle for fibers? That doesn't mean, I think sometimes what our brains think it means. That doesn't mean my bicep has to contract all or none. It's specifically for a motor unit, the nerve and the fibers that nerve recruits. Well, we got thousands right? That's how you ramp it up, but it's all or none for that specific motor unit. And motor units are work in very small areas. So in other words, you don't have one nerve and branches off the fibers all over the muscle. So what that means is when we have muscles that cover a lot of surface area, all of those fibers are going to have something in common, but not all of them will have everything in common. Using my fingers as an example, if I had this fan, all of the fibers would be pulling down, but the fibers to your left would be trying to pull something to your right, and the fibers on your right would be trying to pull something to your left. Do you see what I'm saying? You guys probably have a lot more knowledge, practical knowledge with the deltoid. Anterior deltoid, posterior deltoid. It's the same muscle, just different parts of the fan that I can recruit. All the fibers have something in common, but the anterior fibers have different pulls than the posterior fibers. Okay? We kind of have a deltoidish muscle in our hips. There's going to be a lot of similarities. I just told you rotator cuff kind of stuff in the hips. So there's going to be some lower extremities versions of upper and vice versa. So the gluteus medius, which is superficial, and the gluteus minimus, which is deep, like gastrocnemius soleus. Okay? Now, unlike the deltoid, and I'm going to use the deltoid because I think most everybody's heard the deltoid muscle before. The deltoid, we get a full fan. We get a full shell here. Like what I mean by shell, like, you know, like a half of an oyster shell, maybe not an oyster, but like a clam shell, like a half of a clam shell kind of covers like from here. It's like a geisha fan. You know what I'm talking about? Like a geisha fan, it should do like this and like kind of a 180. So we have spine of the scapula, the acromion, and then we have some from our sternum for our deltoid. We cover all the bases here. It's a full shell. When we get into the pelvis, though, especially how most humans position their pelvis, we don't really have a posterior shell. Like it's almost like a cracked seashell. Like we have a lot of stuff in the front. We have a lot of surface area in the front, and we have a lot of surface area in the middle, but we don't really have like the spine of the scapula back here where it could kind of come from. So for our gluteus medius and minimus, this is going to be our medius, this is going to be our minimus. Our middle fibers practically kind of almost serve as middle deltoids only. We don't really have a posterior big chunk. We have like middle, and then we have anterior fibers. Okay. We've had middles, and we have anterior fibers. And again, you may say, well, that angle doesn't look like a lot, but it's more than what you think because of trigonometry, okay? So our gluteus, medius, and minimus, all of the fibers pull in a direction of abduction. They're abduction pullers because they cross laterally. They're on the outside. Only the fibers that have an angle can pull in a direction of internal rotation. Only the anterior fibers can be internal rotation pullers. It's like anterior deltoids. Like an anterior deltoid is an internal rotation puller because it's the anterior fibers have the line of pull that we need to spin the merry-go-round this way. The middles are just vertical. Anterior, posterior. We don't have a posterior part practically for the hip. And one of the reasons is I just spent 20 minutes talking about all the lateral rotations we have back here. We kind of don't need it. We have a lot of other sharpshooters that are kind of there to do lateral pulls. Okay. Wouldn't we agree that this is a lateral view of the hip, like from the outside? So you can see how it would be crossing laterally. medius on the outside, minimus on the inside. Okay. How would that fit? Medius and minimus. So two separate muscles. Gluteus medius sits on top of gluteus minimus. This is where, and Sarah, interject, this is where, these circles aren't perfect, but this is where you're going to have to know that those are two separate muscles, and all of the fibers are abduction pullers, but only the anterior sitting fibers are actually trying to spin the merry-go-round internally. Does that make sense? No different than upper pec is the only fibers that are trying to do front raises. I mean, you have precedent. Anterior delt exercises, posterior delt exercises. You have precedent for this in fitness. We're just applying it to a new muscle, a lower extremity version of these deltoid sections. Okay. Let's see what I put on for my list people. Gluteus medius and minimus, internal hip internal rotator, the anterior fibers. Only the front fibers have that angle, have that vector component that's trying to spin medially. All the fibers have the components that are trying to pull lateral. This muscle gets accentuated with pelvic position. So like if I'm anteriorly tilted or rotated, I'm really going to shift the fibers at all angles. So in fact, sometimes when I remember back in athletic training, when we would be doing rehab for the abductor muscles, I'd have to really prevent people from naturally being in a flexed position. It was just so natural for them to reposition. Keep that sucker back, that sucker back. So these components for these kind of muscles can get accentuated with your pelvic tilt, making the fibers that were vertical now more anterior, and the fibers that were anterior even more anterior. Again, not going to be on the test, just trying to give you some practical knowledge to why this stuff can be useful. One of my favorites. Okay, guys, the TFL, the tensor fascia latte. It sounds like something you would get at Jet Coffee or something. It's pretty cool. All right, first of all, this is a muscle. Has anybody ever had or worked with people that have IT band syndrome, iliotibial band problems, or IT band? So you have this big band of tissue laterally on your leg. And one of the purposes of that tissue is as we change direction laterally, that big band of tissue that crosses our knee laterally kind of helps to prevent what we call varistress, like our knee just buckling. As we change direction, that's a lot of force that's kind of taking us this way. So we have this big, thick guitar string band that runs from the hip to our knee laterally. And the muscle, you have other muscles that kind of blend into it through fascia, but in terms of a muscle that's actually yanking on that guitar string, this is the fingers that are plucking on that string, the tensor fasciae lata, the TFL. three-dimensional muscles can be tough in a two-dimensional picture. So we'll try to look at it in different ways to see the different functions. But the function I think that's easiest to see from this picture is the flexion function. Pulling in a direction, flexion. There's the hip, sits in the front of class. Does that make sense? Dr. George used to call this muscle the pocket muscle, because it kind of runs like the seam of your pocket down here. So it's going to be a flexion puller. A front view would help to see how it crosses laterally. And then because it's kind of at an angle right here, it's going to have an internal rotation as well. Again, all those functions are hard to see with this lateral picture. But the anterior pull should be easy to see with this lateral picture. And then we'll look at different pictures. Oh, my bad. So sometimes when we call this stress varus, we call this kind of stress valgus. So like if you were doing this would be valgus stress, and this would be varus stress. So like if a football player, if someone landed on the outside of their knee, we'd call that valgus stress. You would tear like the MCL, right? When you're changing directions, you're creating valgus stress. If I'm running this way and do this, my knee actually wants to pop the lateral collateral ligament this way. So we call that genu varum. Cowboys are common to have genu varum, right? They're commonly bow-legged, which is a varus stress because their knees form around the horse, as opposed to knock-kneed, which is genu valum. Does that also fit your understanding, or were you taught something different?
No, I understand. I was pretty sure it said that in prevents the need of knowing various going out.
It prevents, so this is my right knee. It prevents genu valgum. Don't pay attention to this going out. Pay attention to the adduction of the knee. Valgus would be abduction of the knee. Varus would be adduction of the knee. Does that make sense? Awesome. It's confusing. But just think, if I change direction here, my knee is not going to want to pop like this. My knee is going to want to pop like that. And so that band on the outside helps to prevent valgus stress. Is that better? Good. Thank you for asking. Good stuff. Yeah, look, I'm just an old fogey. So if there's something that contradicts something else, bring it up. Let's figure it out. All right, this is a much better view for the lateral crossing of that muscle, right? You couldn't really see. That'd be unfair to look at that picture and see how that muscle would be an abductor. This is a lot better. You can see the lateral crossing of the TFL, the tensor fasciae lata. Make sense? So flexor, we're in a flex position a lot, putting that muscle in a sling. Abductor, it's common to kind of be abducted too. We work those every time we have a gait. The harder one, and that's why I love this picture. So again, this helps to show, even though it's very steep, it's in quadrant 1. So that means that it has to have an X component and a Y component. The Y component anteriorly is going to be the flexion pull. The Y component laterally is going to be the abduction pull. But the X component, even though it doesn't look like it's there, it has to be there, and it's more than what you think. That's the internal rotation pull of the TFL, the tensor fasciae lata. So this is a doozy. It's a muscle that pulls in all 3 dimensions. It's a flexor, abductor, internal rotator. That means it gets recruited a lot, which helps if it's pulling on a guitar string that's trying to help the lateral stability of our knee. But sometimes there's too much, right? My son wants to get my attention. He taps me on my shoulder, no big deal. But if he would tap me on my shoulder for 3 straight hours, I might have ecchymosis and bruising on the tap, right? Too much of something. So a tight tensor fascia lata pulling on that IT band. Again, I'm not going to ask you this on the test. This is me taking 2 minutes to show you practically. If that muscle is extra tight because you're using it a lot, you start walking, you start jogging, maybe your position throughout the day puts that muscle in a sling, and when you get out of that position, that muscle is really tight. It's going to pull on this guitar string even more. And this guitar string is being plucked, not by that muscle. You know what that muscle is a better analogy. That muscle is the little knobs to tighten it, to tighten the strings. But what's actually plucking the string is these condyles up here, like the trochanters, because as you flex and extend, those trochanters are going to be passing through. Or distally, your knee condyles, as you flex and extend when you jog, those condyles are plucking the string, the guitar string distally. So it's common for people to have lateral pain on that IT band because when they begin exercise or activity, or heck, even my cross-country kids at NC State, repetitive plucking of the string can eventually cause, inflammation and pain, and then you treat them for IT band syndrome. All right, let's look at how this gluteus maximus, there is some debate on this, because certain structures have fat. The whole body is just one continuous fascia from head to toe, and these muscles are actually just shrink wrap compartmentalized in this fascia. And so sometimes we see fascia and we just assume that's tendon pull. So the gluteus maximus kind of passes underneath and is yanking on the femur. Like, think about it. Think about how strong the gluteus maximus is. I don't want that muscle yanking on a guitar string. Does that make sense? Like a big, powerful muscle like that, I want it pulling on a big, powerful bone. So that can sometimes get confusing when you have this kind of blending in onto this to this fascia, and it looks like all the bones are yanking on it. But this is kind of really what's happening here. I'm sure I have this picture for the glute max, but I just want to make sure because it does get a little. Does that make sense? Like, again, a big, powerful muscle like that, you don't want to yank it on a movable string. Pop the string. So it kind of passes underneath, but fascia connects it because proprioceptive wise, we kind of want to know where everything's at and what everything's doing. And okay. So how does the tensor fascia lata fit in our circle? If you're a circler, there's our TFL. Crosses the hip anteriorly, so it's a flexion puller. Crosses the hip laterally, so it's an abduction puller. And because it's at an angle, those medial fibers pull internally. The X component of it is an internal rotation. If you do function based off of this, no problem. Let me make sure I have it correct. Hip internal rotator, hip flexor, hip abductor. Tensor fascia lata. right? External force is trying to extend me. I need flexion pullers. We didn't go over all of them yet, but I just wanted to hip the tensor fasciolata as part of the group that can contribute to hip flexion pull. Right? We're just doing a little practice so we never lose track of applying this stuff. If I observe hip flexion, tensor fasciolata is going to work concentrically. If I observe extension, tensor fasciolata is going to work eccentrically. Look at something like this. The key thing is looking at how the hand is pushing. So we're going to assume that he's pushing on that lower leg. Bones only push. So even if he was pulling this way, the hand's still pushing on the lower leg is what I'm trying to get to, right? So is he trying to push her into external or internal? External. He's trying to push her into external. So you wouldn't want to use external rotation pullers. You'd want to use internal rotation pullers. Does that make sense? Versus this one. This one, he'd be providing an internal rotation force. So you'd be testing muscles that are pulling in a direction of external rotation. You'd be testing external rotation force. And again, why is this important? If you're doing manual muscle tests for like little intrinsic muscles or muscles that aren't as obvious as bicep and tricep, you kind of have to know how to set up the external force so that you know which agonist you're recruiting, right? So in other words, if I want to do a test for external rotators, I would need to produce an external force that's trying to internally rotate me and say, okay, don't let me push you. Don't let me push you in. Don't let me push you in. Don't let me push you out. Don't let me push you out. Don't let me push you to the side, right? It's the same stuff, just applied in non-traditional maybe muscles that we haven't seen yet. Okay. Which muscles, open-ended, you can look at your, obviously we're not to the part, we'll learn them eventually, but am I testing ab or ad here? Ab. I'm testing ab because the external force is trying to adduct me, right? Isn't he trying to push me into adduction? So here are the options. Turn all the muscles off. Use the adduction pullers and you're going to hit your knees even harder, right? So the person trying to adduct me means I need to try to abduct me within, right? I'm working abduction pullers. And my technique of circles is to try to help you remember who are those major muscles. Or like I said, you can learn them with a list or you can learn them by visually seeing them. The only problem, or I'm trying to teach you the concern, or my concern is when you try to see everything holistically, there's some things that just get in the way. Like it's hard, and especially at different angles. Like it's hard to, like when we talk about that darn TFL, right? Like it's really hard to see through this picture how that muscle's an abduction pull. So I'm not saying don't see pictures. I'm just explaining how one view of a three-dimensional pulling muscle can be limited. And so one way that you can try to learn it where you cover all your bases to make sure that you have all of your bases covered is the cross-sectional approach to functioning. Where if I'm looking at the functions of the tensor fascia lata, now I don't have to just look at one view. I can see the functions, and then the way I do it is I see, all right, the tensor fascia lata is a flexor, abductor, and internal rotator. Then I can reverse engineer the views I need to see. Oh yeah, it's a flexor because of this, or it's an abductor because of that, or it's an internal rotator because of that. But it's hard to have a Rolodex of every possible view for all of these multi-dimensional muscles. The circles are just meant to be a cheat sheet for function, for pull. It's not meant to replace seeing things in the body. It's just to help us remember all of the different things these muscles might do in different dimensions. That make sense? All right, we got 3 minutes. Let's quickly review. We talked about our little lateral rotators today. We talked about the piriformis that kind of branches off and pulls some differently. We talked about the tensor fascia lata today. We talked about the gluteus medius and minimus today. We're just going to continue the conversation. So we'll just keep going through the different muscles. We'll get into the adductor group. We'll get into the glute max. We'll get into the hamstrings at the hip. And then hopefully we'll just keep practicing and doing situations and doing scenarios. How would you stretch this? How would you work that? And the last part will be link tension relationships of these muscles that cross hip and knee, so that I could show you how by flexing the knee, we put the hamstrings at slack. And so when we do gluteus maximus exercises, like, you know, those popular exercises where you put the big bar of weight and you do this kind of thing. Well, one of the reasons that works your butt more is because your hamstrings are on slack. So they can help, but they can't help as much as they normally could. So the gluteus maximus is like, well, I guess I got to take up your slack that you got, and it works. So we'll go into those kind of things eventually too when we go into multi-crossing muscles of the hip and knee. Okay. Any questions? Are we comfortable on our progress? All right, got you. Let's go. Oh, Sarah's going to have office hours tomorrow in the computer lab from 10 to noon. I'm going to email everybody the lecture for Friday because I'm going to be speaking out of state in Texas. And office hours Friday will be virtual. Text me, call me, FaceTime me, and heck, I'll pull over if we got to talk, all right?